You have been following the same general health advice for years: watch the salt, exercise regularly, take your medications, get your annual checkup, and yet something feels like it is not quite fitting. Your neighbor takes the same approach and responds differently. You both eat reasonably well, but your cholesterol patterns diverge. You both manage stress, but one of you sleeps through the night and the other does not. You have been treated as the average patient, and biologically speaking, the average patient does not actually exist. There is a piece of information you recorded on a medical form years ago and have thought nothing about since: your blood type. And researchers from Harvard who spent 20 years tracking 90,000 people found that it is one of the most precise biological maps your body carries, not for transfusions, for predicting and preventing the specific health risks that are quietly building in your body right now. If this channel has ever given you something worth knowing, hit that subscribe button right now, leave a like, and drop a comment below, because that is what keeps this kind of conversation reaching the people who genuinely need it. I'm Dr. Mercer, and this channel exists to bring you the latest evidence-based research on senior health, simplified and designed for adults over 60. Stay with me through this entire video, because by the end you will understand what the research shows about how each blood type, O, A, B, and AB, corresponds to specific and distinct health vulnerabilities and advantages, what the evidence supports as a targeted protocol for each one, and why this information fundamentally changes how you should be thinking about the generic health advice you have been given. Let's begin with the problem that makes this conversation so relevant and so consistently absent from clinical appointments. For decades, preventive health recommendations have been designed for the average population: the same blood pressure targets, the same dietary frameworks, the same stress management suggestions, applied broadly to everyone in a given age group regardless of their specific biological profile. The difficulty is that the average population is a statistical construction. No individual is the average. Your blood type is not a minor administrative detail. It is a biological variable that influences your coagulation profile, your immune response patterns, your baseline hormone activity, your susceptibility to specific pathogens, and your risk for specific diseases, all of which have direct implications for how you should be prioritizing your health behaviors after 60. The Harvard study published in the journal Arteriosclerosis, Thrombosis, and Vascular Biology, which tracked nearly 90,000 adults across 2 decades, found that blood type O individuals carried a 20% lower risk of coronary heart disease compared to all other blood types, while blood type AB individuals showed an 82% higher risk of cognitive decline and memory impairment compared to type O. Those are not marginal variations, they are clinically significant differences in risk profile that should inform personalized prevention, and they almost never come up in a standard appointment. Let me now walk you through each blood type, the specific mechanisms behind its distinct risk profile, and what the research supports as a targeted approach for each one. Blood type O is the oldest blood type in the human evolutionary record, emerging approximately 50,000 years ago in early populations who lived as hunter-gatherers. It carries the most notable cardiovascular advantage of any blood type. The mechanism is specific. Type O blood contains lower levels of a clotting protein called von Willebrand factor. Lower von Willebrand factor means less clotting activity, which means blood flows more freely through the vessels, arterial pressure is more manageable, and the risk of thrombotic events is structurally lower from birth. The Harvard study documented that 20% lower risk of coronary heart disease in type O compared to all other blood types. That is not a lifestyle benefit, it is a biological baseline, but there is a vulnerability that almost nobody discusses: your stomach, the bacterium Helicobacter pylori, which is the primary cause of gastric ulcers, chronic gastritis, and a significant contributor to gastric cancer risk, attaches far more readily to type O stomach tissue. The surface receptors on type O stomach cells are more accessible to this particular pathogen, meaning type O individuals are statistically more susceptible to H. pylori colonization and recover more slowly from gastrointestinal infections. H. pylori does not announce itself dramatically, it colonizes silently and over years erodes the stomach's protective mucus lining. By the time symptoms appear, the process has often been underway for a long time. If you are type O and have never been specifically tested for H. pylori, this is the first conversation to have with your physician at your next appointment. The test is simple, either a breath test or a stool antigen test, inexpensive and widely available. I had a patient I will call Gerard. He was 63, type O. Managed occasional mild digestive discomfort that he had attributed to dietary choices for several years, when we specifically tested for H. pylori as part of a broader gastrointestinal assessment. The result was positive. He had been living with it, undetected, for an estimated 3 to 5 years based on the degree of gastric mucosal changes. Treatment was straightforward once identified, he told me after. Had nobody tested for this specifically, he would have continued attributing the discomfort to something else indefinitely. The Type O protocol is built around 2 priorities. Physical movement is not optional, it is a genetic necessity. Type O individuals carry the highest baseline levels of dopamine and noradrenaline of any blood type. Without regular physical output, these neurochemicals have nowhere to go, which manifests as restlessness, disrupted sleep, and over time, metabolic dysregulation. 30 minutes of walking daily combined with resistance training twice per week delivers more long-term benefit for Type O than most supplements. And gut protection must be active. This means limiting NSAIDs such as ibuprofen and aspirin to medically necessary use only, because these drugs irritate stomach lining in anyone but land on tissue that is already more vulnerable in Type O. Adding 2 to 3 servings of fermented foods per week, kefir, sauerkraut, natural yogurt, measurably supports the gut microbiome against the bacterial imbalances Type O is more susceptible to. Blood Type A emerged approximately 20,000 years ago as populations shifted from hunting to agriculture and began living in greater social density. The immune system evolved to handle new viral threats aggressively. Type A mounts strong immune responses against viral infections. In younger years, that is a genuine advantage, but the price is a coagulation profile that creates a statistically higher risk of thrombotic cardiovascular events. The study published in Circulation, one of the world's leading cardiology journals, found that Type A individuals carry a 23% higher risk of heart attack compared to Type O. The mechanism is platelet stickiness. Type A blood has higher baseline coagulation activity. There is a second layer that compounds this. Type A individuals carry the highest baseline cortisol levels of all blood types. Cortisol in short bursts is protective, chronically elevated, running high day after day across decades. It inflames arterial walls, disrupts sleep architecture, impairs insulin sensitivity, and accelerates vascular aging. The specific mechanism is this: cortisol damages the endothelium, the thin inner lining of the blood vessels, when this lining is chronically inflamed and less elastic, and when platelets are already genetically stickier than average. Those inflamed vessel walls become precisely the surface to which the platelets adhere. The combination of chronically elevated stress hormone on top of higher coagulation activity is what makes Type A cardiovascular risk both real and directly addressable through deliberate lifestyle management. I had a patient I will call Bernard. He was 54, Type A, healthy weight, non-smoker, genuinely active. His cardiac event came on a Tuesday morning after a sustained period of extreme occupational stress. His cortisol had been running at crisis levels for weeks. His platelets responded exactly as they were genetically programmed to respond. That is what Type A looks like in a chronically high-stress environment that is not being actively managed. The Type A protocol centers on cortisol management as direct cardiovascular intervention, not as a soft wellness habit, blood pressure monitoring every 6 months rather than annually, because cortisol-driven vascular pressure builds silently in Type A individuals. A daily cortisol reset practice, 10 minutes of slow deliberate breathing with 4 seconds in and 6 seconds out performed consistently every morning. What matters for cortisol regulation is consistency rather than duration. 5 minutes daily outperforms 1 hour on weekends because cortisol is a daily biological process. And at the next blood panel, ask your physician specifically to check homocysteine levels. Type A individuals tend toward elevated homocysteine, an amino acid that when high actively damages arterial walls. The targeted nutritional response is folate, B12, and B6 through dark leafy greens, eggs, and legumes. Blood Type B emerged approximately 15,000 years ago among nomadic populations moving across Central Asia in continuously shifting environments. The body adapted by developing the most metabolically flexible immune system of any blood type. Type B can process a wide variety of animal proteins, fermented dairy, grains, and plant foods without the inflammatory response that other blood types sometimes produce. This metabolic adaptability is the Type B advantage, but the same flexible immune system, when pushed too hard by chronic inflammatory inputs from the modern food environment, overshoots. Type B individuals show statistically elevated rates of autoimmune conditions, including rheumatoid arthritis, Hashimoto's thyroiditis, and certain forms of inflammatory bowel disease. These frequently go undiagnosed for years because the early signals, persistent fatigue, joint stiffness, mild digestive irregularity, are easily attributed to normal aging. The modern food environment creates a particular calibration problem for type B. Refined sugars, processed seed oils, and ultra-processed foods do not just deliver empty calories in type B individuals. They trigger systemic inflammation that progressively distorts immune precision over time. Certain heavily processed corn and wheat-based products appear to create a particularly disruptive inflammatory response in this blood type. The Type B protocol prioritizes annual C-reactive protein, or CRP, measurement as a primary inflammatory monitoring tool. A consistent CRP reading above 1 mg per liter without a clear infection cause means the immune system is running at elevated inflammatory activity, and this conversation belongs explicitly with your physician. Reducing processed foods is not generic advice for type B, it is biological instruction because your immune system processes these inputs differently to other blood types. And for physical activity, moderate sustained movement, cycling, swimming, walking, works better than high-intensity training for type B specifically because intense exercise without adequate recovery spikes inflammatory markers in this blood type more sharply than in others. Blood type AB is the youngest blood type in human history. Appearing approximately 1,000 years ago as type A and type B populations mixed, it inherited immune tolerance from both parent types. Type AB individuals have fewer inflammatory immune reactions to foreign cells, which confers meaningful protection against certain gastrointestinal and gastric cancers. But the inheritance also includes a coagulation profile that has significant implications for brain health, the 82% higher risk of cognitive decline compared to type O, documented in the Harvard research, is driven by cerebral microcirculation. Type AB's coagulation profile creates subtle, cumulative changes in blood flow through the brain's smallest vessels over decades, not large blockages, not dramatic events, micro-changes happening silently in vessels smaller than a human hair, year after year. The result is a gradual reduction in the efficiency of blood flow to specific brain regions, particularly those responsible for memory formation and executive function. Small vessel disease is one of the primary drivers of age-related cognitive decline, including vascular dementia, and here is the critical point for type AB. Brain vessel health and cardiovascular vessel health are the same health, they share the same infrastructure. Every choice that protects your heart vessels protects your brain vessels simultaneously. The Type AB protocol makes brain and cardiovascular health explicitly unified. Blood pressure control, blood sugar regulation, and cholesterol management are the primary cognitive protection strategy, not only cardiac ones. Omega-3 fatty acids, specifically DHA, directly support cerebral blood flow and reduce neuroinflammation by being incorporated into neuronal cell membranes. 2 servings of fatty fish per week, salmon, mackerel, sardines, or a quality fish oil supplement discussed with your physician, provides meaningful support. Sleep is the most important single daily behavior for type AB. During deep sleep, the brain's glymphatic system activates and clears amyloid plaques, the protein deposits associated with Alzheimer's disease. When you sleep fewer than 6 hours, that clearance is incomplete and residue accumulates. Type AB individuals who consistently sleep under 6 hours show accelerated cognitive markers in long-term studies. 7 to 8 hours every night is not a wellness preference for type AB. It is the primary neuroprotective behavior available to you. Before I give you the action steps, I need to say something clearly. The blood type research is based on population-level statistical data. It describes elevated probabilities, not predetermined outcomes. These findings do not mean that all type A individuals will have heart attacks, that all type AB individuals will develop dementia, or that type O individuals are protected from all cardiac events. They describe tendencies that inform where you should be focusing your prevention efforts. Additionally, many of the lifestyle interventions discussed, blood pressure management, anti-inflammatory eating, sleep optimization, cardiovascular monitoring, are beneficial for all blood types and all adults over 60. The blood type framework adds a layer of personalization to decisions you should already be considering, not a replacement for comprehensive medical care. If you are managing any diagnosed condition, Do not alter medications, supplement protocols, or treatment plans based on blood type information alone. All such changes must be made in conversation with your physician who has your full clinical history available. The research provides context for prevention, not a prescription for treatment. Now, there is one additional variable that half of all blood type discussions overlook: the Rh factor, the positive or negative after your blood type letter. Approximately 85% of people are Rh positive. The remaining 15% are Rh negative, and the difference influences immune system calibration in ways that matter for chronic inflammatory conditions. Rh negative individuals show a subtly different cytokine profile, meaning the immune system's chemical signaling operates at a different baseline. Some Rh negative individuals appear to show heightened sensitivity to inflammatory triggers. This means that regardless of your primary blood type letter, if you are Rh negative and managing any chronic inflammatory condition, the anti-inflammatory protocols described above become even more specifically relevant to you. Know your complete blood type, not just the letter, the Rh factor too, and make sure your physician has both on record and context. Here is exactly what to do with what you have just heard. Step 1. Confirm your complete blood type including Rh factor and write it down. If you do not know it with certainty, ask your physician to confirm it at your next appointment. Step 2. At that appointment, ask specifically for the tests most relevant to your blood type. For type O, H, pylori testing if not recently performed. For type A, homocysteine and 6-monthly rather than annual blood pressure review. For type B, C-reactive protein as part of your routine blood panel. For type AB, ask whether a 24-hour ambulatory blood pressure monitor is warranted to assess whether your pressure is adequately dipping overnight, and discuss DHA omega-3 supplementation. Step 3. Identify the single most relevant lifestyle priority for your blood type and make it non-negotiable for the next 30 days. For type O, daily movement. For type A, a daily cortisol management practice. For type B, meaningful reduction of processed food intake. For type AB, protecting 7 to 8 hours of sleep. Step 4. Ask your physician whether your current health management plan is specifically calibrated to your cardiovascular and inflammatory risk profile rather than applied as a general protocol for your age group. Step 5. Schedule blood panel follow-up in 6 months rather than 12 if your blood type profile places you in a higher risk category for the condition most relevant to you, whether cardiovascular, inflammatory, or cognitive. One important clarification before we close: the distinctions described in this video are real and supported by large peer-reviewed population studies, but they describe tendencies at the population level. Individual outcomes are determined by the interaction of genetic predisposition and the choices made. Consistently over decades, I have seen type A patients with excellent cardiovascular health in their 70s because they addressed cortisol management as rigorously as any prescription. I have seen type O patients with serious gastric disease because they ignored every digestive signal their body produced for 30 years. And I have seen type AB patients in their 70s with sharper cognitive function than people 15 years younger, not because their genetics were somehow exempt, but because they treated sleep, omega-3s, and blood pressure control as non-negotiable daily priorities for decades. The statistical risk was still present for all of them. What differed was whether they used the information as a tool or ignored it entirely. That distinction is where your choices live. Your blood type is not a sentence, it is a map. The map tells you where the terrain is difficult. What you do with that information is entirely yours to decide. If this video gave you something useful, hit the like button right now. Leave a comment telling me your blood type and whether the risk profile described today matches what you have experienced in your own health, and share this with someone you care about who has been following generic health advice without ever considering whether it fits their specific biological profile. Subscribe if you have not already, and I will see you in the next one. Take good care of yourselves.